morning, Putney Mead, Iris speaking.
Yeah.
I'm just trying to see who else does it.
And your name?
Who else does that thing for you? I'm trying to see which other doctor does it.
Hello. Sorry, I've kept you waiting too long.
It's all right.
How are things?
It's peculiar what happened. I was stung on my arm by a wasp that came in through the window.
OK. So when was this?
It was a couple of days ago. I couldn't move my arm. It swelled up and then it felt achy all the time. It's still funny, my arm. I don't know whether it's because I'm a funny woman.
Do you want to show me where the wasp stung you? Do you want a hand? There we go. You got that one?
It sort of swelled up there and it still prickles or something and aches.
Well, nothing's hot or red or angry.
It aches still.
Now, what's happening with the psoriasis? Have you been going to see the dermatology nurses?
I haven't because I've been too busy.
Because they were supposed to see you, weren't they, in the daycare so that they could do your creams for you. It's still quite bad on your elbows, isn't it?
It will go. It doesn't hurt.
What's stopping you from going to see the nurses?
It's because I'm tired. I get tired. I can't sleep at night. I lie awake. We're moving.
Yeah.
And it's awful.
What's happening with your sister?
She's going to the country.
OK.
Retirement home.
And have you found anywhere that you're going to live?
No, I can't find anywhere.
As GPs, we're always taught that we should ask open questions and let patients tell their story, but it can be really difficult when patients bombard you with lots of different pieces of information at once. In a 10-minute consultation, that's really difficult.
So are you wanting to buy something then?
I want to buy a flat for the rest of my life. I'll be on my own with my cat, that's all. My sister doesn't want me anymore.
Oh. So did you ever think about going with her, or do you want to stay in Putney?
I want to be near Morley College, where I give concerts and I play Beethoven, Chopin, Brahms, Rachmaninoff. And I played all my life since I was 5 years old.
OK.
Music keeps you young. It kept me young. My father died of a heart attack in the hospital. I just visited him and he said, good luck for your concert. And it was sad, really.
No, it is.
He said, be happy when you play. And he smiled, that's all.
I'm falling apart, basically.
Right. Oh dear, OK.
The last 4 or 5 days, I think I had an ear infection. My ear was agony.
Right.
And also, I would like you to look up to see what progress they're making towards this hernia.
Right.
And the large cyst I found, and I've had enough.
Yeah.
Do you mind if I have a good look at all the joints on each side? No, have a look at everything.
Pain when I'm pushing?
Yeah.
Up and down, does that cause pain? OK.
Yeah.
Bet they fractured the bone in my groin.
When?
When they done the angiogram.
OK, all right. Where do we start?
You have to go in soon.
What?
You know, the doctor's going to look at your ear.
OK.
Are you going to be a good boy and let him look?
OK.
Are you going to be a good boy?
Yeah.
Hello.
Hello.
Yeah.
How are you?
I'm well, thank you.
Hey, baby.
Hello, Matthew.
Hi.
When did I see you last? That was a while ago.
Hey.
It was
It is a
quite
while
like
ago.
10, more like 10.
Yeah, 12 now already. He has got another ear infection, and I only noticed it yesterday evening when we were in church that he had a lot of gunk coming out of his ear. He won't let me touch it.
Right.
He insists that it doesn't hurt, but he quite often does that. I've never been able to be sure whether he's just got a very high pain threshold or whether his communication's a bit off around it.
Cough, cold, snuffly nose.
He's been very tired, but no, not really. No. And
Fever?
it's quite difficult with Matthew because he doesn't tend to develop particularly high temperatures.
No.
And quite often, you know, it's only when you see the evidence of something. I imagine this has probably been quite uncomfortable for him for some time, but it's only seems to be when there's some visible sign.
Can I just have a little look at your ear?
Yeah.
It's a bit of a mess, isn't it? You can't see it, though, can you?
He won't let me clean it or anything.
Can I just touch it with a stick?
Hi.
Yeah, not going to go inside, just on the outside. Get a little bit of that fluid. You look at Mummy for me.
Matthew, look at me.
That's good boy.
Look at me.
Ow, ow, ow.
Good boy, good boy, good boy, good boy, good boy, good boy. Ah, good boy.
Well done. Good boy, Matthew.
I like your jacket, Theresa.
I'll do you. Well, you're not having it. I'm not joking. I've seen you for a while.
No, we haven't. Have you been well this early?
Yeah, but did you have to get fun
So
one
yesterday, I read this, and it really frightened me when I read it.
Oh, really? OK, well, we can talk about that. With this, what scared you about it?
It scared you about people dying, you know, not surviving the operation and that.
Yeah. OK. Did you understand what it's talking about, this
Yeah.
aortic aneurysm? Yeah. What did you understand by it?
Well, because my father had one.
Did he? You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot. Do you know if I've got one?